Hello, my name is Dr. Professor Rahul Singh, working as a professor in the Department of General Surgery at IQCT Medical College, Durgapur, West Bengal. And this video's purpose is to educate the general public. The question posed to me is, how should you identify peripheral arterial disease? What are the signs and symptoms of peripheral arterial diseases? The peripheral arterial diseases means diseases of the arteries in the peripheries. Peripheries means the two upper limbs and the two lower limbs. Everything that is beyond our trunk and head, that is peripheries. Now, peripheral arterial diseases will ultimately be classified for general public into critical and subclinical. The most important part is diagnosing the subclinical, wherein it is not frankly apparent. So anything which will have less blood supply will have slow changes which are apparent and progress to more serious changes later on. So skin changes, nail changes, change in the texture of the skin, color of the skin, change in the temperature of the skin, slowly developing to pain, pain presenting earlier as walking over a moderate distance and then developing pain. Then this distance keeps on reducing and it is not relieved even after giving rest. Ultimately, pain at rest. That means now you are going to have gangrene. All of these things have to be noted by the patient, him or herself. So if there are any changes occurring in your skin, in your nails, in the hair, I am talking of the body hair, there is unexplained pain which is nagging you again and again, please go and see your doctor. If it is a peripheral arterial disease, good news is it can be treated. It can also be cured in many cases. Lifestyle modification, treatment of existing comorbidities like diabetes, blood pressure, surgical techniques if there is any structural problem like bypassing a major arterial segment, putting in a stent, and other modalities of treatment right from antiplatelet drugs up to Trental, age-old Trental. There are multiple arms and ammunitions available to your doctor to help you out. Get it treated earlier. Only thing is, look out for the changes of the limb which is dying a slow death. It is crying out to you, please listen to what it is telling you. And another part of the question was how to treat diabetic foot. Now, diabetic foot, the treatment will start with the patient factors. Patient has to take care of his or her foot. So foot care, number one. This needs training by a podiatrist or a diabetic care specialist, a surgeon, foot surgeon, anyone who is trained to do what is important. Using good footwear, adaptive proper walking techniques, assessing the foot on a daily basis, hygiene, applying correct type of lotions, not applying lotions or oils in between the toes. All these things will help in preventing it. All decaying its progress, decelerating its progress. Then control of diabetes, control of other comorbidities that diabetics suffer from, using techniques both pharmacological as well as surgical to correct the present stage of disease. Ultimately, all diabetic foots are complex diseases. They are not only angiopathies, they are also neuropathies and they are also arthropathies. So, treating a diabetic foot is much more difficult than treating a Burgess disease, for example, wherein you have a fixed component affecting a fixed type of artery. But here all types of vessels are affected. You can have a femoral block, iliac artery involvement, and even microangiopathy. So diabetes is more complex, and post amputation In many countries, below knee amputation is not considered a disability. But in diabetes, any amputation, the chances of dying in next 5 years is very high. So in diabetes, you have to act earlier, you have to be more aggressive so that you don't end up in amputation, because amputation may not be a predictor of mortality in other diseases, but in diabetes it is a predictor of mortality. So with diabetes, the best thing to do is act early and act aggressively. That is what you have to do. For other peripheral vascular diseases, listen to your body, it is giving a shout out to you. If you act in advance, you will be doing well. Thank you.